Hello again, it's Dr. Mo, and what I wanted to talk about on this lecture is the common questions that I get asked from my patients during my appointments, and so I've been thinking about what are probably the top 10 most common questions I get asked frequently, and go over some of those questions and answers. So go ahead and get started. So probably the most common question that I get asked about Suboxone is that if I'm on Suboxone, if I get started on Suboxone, will I then later on, when I try to come off Suboxone, have withdrawal symptoms? And the simple question, that's a simple question, the simple answer is yes, you will. So why is that? The reason why you have withdrawal symptoms when you're coming off Suboxone is because Suboxone is an opiate-based medicine, and so in order to even qualify for being on Suboxone means that you have an addiction to opiates, and part of an addiction to opiates, as you well know, is having withdrawal symptoms when you're not using, and Suboxone is very good at controlling withdrawal symptoms and controlling cravings, but because you already have established that in your nervous system that you have withdrawal symptoms, and Suboxone stops that from happening, when you do come off Suboxone, those will resurface. So I wish I could tell you, hey, get on Suboxone and later on we'll just taper you right off and you'll not have any withdrawal symptoms, but that simply isn't true. Although when Suboxone came out, that was what we were being told by the company, that hey, get them on Suboxone and then later on you can get them off very easily, and that's just not true. People will have withdrawal symptoms, and it really does depend on how much opiates you use, what type you were using, how frequent you were using before you started Suboxone, because that's probably what you're going to experience when you're coming off Suboxone, is going through some of those withdrawal symptoms. So that leads me into question number 2 that I'm asked frequently is, what's the best way to come off of Suboxone? So the best way to come off of Suboxone, in my estimation, is slowly decreasing your dose. So if you're at a point in your treatment where you're deciding, hey, I think I really want to come off Suboxone, and how do I do that? How should I do that the right way? The people that have been probably the most successful in coming down and getting off of Suboxone did it pretty slowly. So let's take for an example that you're on 16 milligrams of Suboxone, which is the average dose of Suboxone. I would say that coming down on your dose probably around 1 milligram a week is pretty fast. So that would be, if you were to do that, obviously if you're on 16 milligrams and you came down 1 milligram a week, that would be 16 weeks, which is roughly 4 months. So a 4-month detox, which that's a pretty long time, but in the scope of things, 4 months to getting off of something, totally getting off of something, isn't all that long. Some people have done better even slowing that down, maybe coming down 1 milligram every other week. Again, you would just double the time, so instead of 4 months it would be 8 months, and some people have taken up to 1 year of getting off Suboxone. But I think that the key in coming off of Suboxone would be that you come up with a schedule in your mind, you write that schedule down, and you really have something that you're trying to stick to. And probably the people that have done the best share that with somebody else, like a wife, husband, boyfriend, girlfriend, parent, whatever, and say, hey, here's what I'm trying to do, and this is the schedule I want to stay at, and they have somebody else kind of holding them accountable to that. The people that don't do very successful in coming off Suboxone don't really have a schedule. They are just trying to do it without really writing it down or thinking about how they want to do it. and they may say something like, well, I want to just see how I do if I cut down on my dose. So they really don't have a scheduled decrease really written down. They aren't really sharing that with anybody. And so they're just trying to go down on their dose a little on their own, basically, and not really have that structure built into how they want to detox. The other people that are successful, though, are the ones who, like I said, have a schedule. They kind of stick to a schedule. They aren't in a huge hurry to get off. They understand it takes a little bit of time to do that, and they go ahead and start just systematically coming down. Now, when they get down to lower doses, the other thing that's helpful is I can give you some medicines, like something to help you sleep, something to help with the anxiety or some of the jitteriness that you might feel when you're coming down off of Suboxone. So even though you will start experiencing withdrawals, the more time you give your body to readjust to a little bit lower dose, the better off you are. And we can then try to help you at the end get totally off by giving you other medications when maybe the withdrawal symptoms get worse. And typically the withdrawal symptoms do get worse, I would say around anywhere between 4 milligrams of Suboxone and down to 0 is when probably the most severe withdrawal symptoms people have. So that's kind of what you would anticipate, and we can try to help with that process. So you would just need to talk to your provider about that and how you want to do that and come up with a good plan. So that was the question, second question I get asked a lot. The third question would be, if I do get off Suboxone, let's say, imagine you get off Suboxone completely, what are my chances of relapsing? So if you were to look at statistics of relapse, once somebody is totally detoxed off of an opiate and you follow them out in a year's time, the statistics are that they have a pretty high chance of relapse. Somewhere between probably 80 to 90% of people in a year's time will have relapsed back to using opiates. Now there's a lot of reasons why that might be true. Some of the most common reasons why relapse happens after somebody detoxes off Suboxone or an opiate is that they'll get re-exposed somewhere down the road. Let's say that you get in an accident, or you have some other kind of medical or dental procedure where they give you a pain medicine. Typically that's something that will trigger back to you wanting to use again. So it's very crucial that if you were to detox off of opiates, that you understand that that's the times where you get re-exposed to any other opiate is a very dangerous and critical time, so you want to be very careful during that time. Some other reasons why people relapse. Well, if you, let's say you're on Suboxone and you did well and you came off and you really worked hard at getting off and you typically are doing well, the problem that a lot of people have is that they really aren't treating this as a chronic condition. And what I mean by that is, let's say that you're successful getting off Suboxone. Well, that doesn't really change your history. And if your history is that I have had problems with opiates, you have to always treat yourself as if, hey, you know, I've had trouble in the past, and that probably means that I'll always have a problem with opiates even though I'm off of everything. So being around other people that are using opiates or just being exposed to them is really not a good idea. What other kinds of things? Just not really having any kind of support system around, or keeping to yourself if you're craving or wanting to use, and not having people to talk to, because you know what most people say that are in recovery is that, you know, your addiction is always there and is always trying to find a way back into your life, and so it'll use any opportunity that it can to get you back to using. So if you are going to NA groups or doing something that helps you to remain in recovery, that should continue even though you may not be on anything. So think of this as a marathon race and not a sprint, and so for the rest of your life you should always probably be involved in some kind of support group or some kind of help so that you don't relapse. Um, Another question is, will I develop a tolerance to Suboxone over time? So the answer to that is, some people will notice that they want to go up on their dose, but because Suboxone is a long-acting opiate and it has some receptor activity that helps protect people, quite honestly, from developing huge tolerance to this opiate. And that's the beauty of Suboxone, is that you can actually be on the same dose for long periods of time, even for the rest of your life potentially, and not really develop a tolerance to the cravings and withdrawal symptoms that it's helping to prevent. So what I've typically seen over the last 12 years that I've been using Suboxone is that people can get on a stable dose and do well, and actually even come down on their dose and be on a lesser dose over time and still do well and not have that tolerance build up as you might see when they're using heroin or other short-acting opiates. So that's what I typically see, and most people do very well on Suboxone for long periods of time. Which then leads me into my next question that I get asked a lot is, how, can I be on Suboxone for the rest of my life if I want to be? And the answer to that question, well, it would depend on who you're asking, but in my opinion, yes, that is something that's an option to you. If you find that this medication is very helpful to you and stabilizes you, you can be on this for the rest of your life if you want to be. It doesn't mean that you have to be, but if you want to be on this for the rest of your life, there's no rule that's stated that says you can't stay on this or you have to come off of this in a certain amount of time. And in fact, the federal government has even stated that for maintenance treatment, meaning long-term treatment with Suboxone or methadone, is that you really shouldn't encourage people to get off of this. You should work with them if they want to come off of this, and you should mention that as an option and see if they're interested in that. But if they're not interested in that and they're doing well and their recovery is going well, then that's fine. You don't have to come off of this. It shouldn't be something that you're pressured off of this from other people or from your provider, and that like I said, the federal government even supports that, is that people with an opiate addiction who have been followed over many years on methadone, for instance, do much better than people that had the goal from the set out to be on methadone for a short period of time and then get off, and then they follow these two groups over time, and the people who have stayed on methadone over long periods of time did much better in their life. So I think that's highly recognized by people in this treatment community that are addiction specialists, is that sometimes the benefit that you get from being on a medicine far outweighs the risk that you take if you're not on this. Now, I want you to understand, I'm not suggesting that that's what you do, that you stay on this for the rest of your life. What I'm suggesting that you do is that you take an honest look about where you are in life, what's going on, and what are your chances of relapse? What has been your history when you've used opiates? And if it's not been a good one, and you've had a lot of trouble in the past when you have tried to come off or have been off for a short period of time and then relapse, or if you've used IV drugs or had some high-risk behaviors when you're using, you may want to pause a little bit and think of how important it is for you to come off of this. Is it because somebody else is asking you to? Somebody else is pressuring you to because they don't like you to be on something? And this is what I hear a lot: well, I don't like that you're on something and I want you to get off everything. Well, because you're still addicted to this, and that's not necessarily how I see that. Again, I think I've talked about this in previous lectures. Usually addiction, when somebody's really addicted to something, they're focused on getting that substance. All their time and energy is revolving around how I get this. all their money is going towards their habit. They're not fulfilling other obligations in their life, and they're really not being very responsible. And then what you see if somebody is doing well on Suboxone is that all those things go away. They're being more responsible, they're being more active with their families, they're not, all their energy and time is being spent just trying to find the drug of choice, and they really stabilize their life. So that doesn't look like addiction. So I just want people to pay careful attention to those things when they're deciding, hey, if I should come off or if I should stay on this medication. Now, of course, if you do come to the conclusion, hey, I really want to try to come down and go off of this medicine, again, I would encourage you to talk to your provider, come up with a good plan, have a lot of supports around your attempt to do that, and do it in a smart way. So I think we can all agree that is, if being off of everything is your goal, there is a smart way to do that. And then the last question, not the last one, but one of the other questions I get asked quite a bit is Suboxone better than methadone? And so there's two treatments out there for addiction to opiates. One is Suboxone and the other is methadone, and then I guess the third is being totally abstinent off of everything. And so everybody's different. I always have to start out with that, and I think that there are really advantages to each different treatment. I've never discouraged somebody from one treatment to the other. I think that everybody needs to make those decisions with the help of someone like myself in the profession that can tell you the good and the bad of each. I really have found that probably Suboxone and methadone are very similar in their ability to help people. I would probably give the edge to methadone as probably the most successful long-term treatment is with methadone. Methadone is a little stronger than Suboxone. It has a little bit more risk associated with it, and you do have to be in a clinic to get prescribed methadone for addiction, but it's very structured. And again, when people seem to be struggling on Suboxone because they're still having cravings or just not quite feeling quite right, methadone is a good option for them. Suboxone being less structured and less strong of a medicine, and quite frankly safer medicine than methadone, is one reason why you can use it in a private practice like people do use it. It doesn't have to be in a clinic, but it is a little weaker than methadone, and maybe not quite as successful, but it is a good option for a lot of people. It doesn't have the structure that a methadone clinic has, meaning you don't have provided groups and counseling and those sorts of things that you would experience in a methadone clinic. But that's why, with Suboxone, even though you may not be in a clinic, you still should be involved in a recovery program, going to groups, having some kind of support systems in place, doing urine drug screens on a frequent basis. And those sorts of things do seem to play a vital role in helping people remain sober while taking these medicines. So I couldn't say one is necessarily better than the other. I think that if you're someone who really has had a long history of high drug use, then you're most likely to do better on methadone. But if you're someone who has had less drug use and maybe not as long drug use, then you're likely to do okay then on Suboxone. And there are certainly a proportion of people that are opiate addicted that do well with abstinence, but it's just not that common. The people that do the best with abstinence have a lot of supports, a lot of structure in their life, and a lot of people that are holding them accountable, because like I said earlier, this is a long-term kind of condition, and it's not something that you cure with a couple months treatment or a year treatment.